Here with Anita Justnes, Chief Commercial Officer, and myself, Ronnie Hermansen. And maybe we should start out, Anita, and why microbiome?
Then I have to take you back to ancient Greek times. Why microbiome? If you know, the modern medicine was, started in the ancient Greek ages, and there was this Hippocrates, this father of the modern medicine, already at that time, 3,000 years ago, saying that all disease begins in the gut. And this is why the microbiome is strongly connected, as we know today, to our immune system, to our ability to fight diseases like COVID. And by mapping your microbiome, we strongly believe that you're mapping your health and that microbiome holds the key to many breakthroughs in the future. That's why we need to look at it. And looking at the problem, why haven't we got all the knowledge and more evidence about microbiome since Hippocrates? And the answer to that is very, very complex. It is a complex area of medicine which needs a focus and needs more investigation. But we have the solution in GA, and we believe that our products, we already have 2 products on the market, and the focus is microbiome, gut microbiome. It's already CE marked. It's called GA MAP, dysbiosis test, for IBS and IBD patients. And we also developed a GA MAP COVID test. So I tried to just give you an introduction with why microbiome, because it's so important for our health, and we have the solution with our diagnostic tools, which is called GA MAP. And then it's all about the market. So this market isn't as big as the pharma market we heard about up until today at this conference. But at the same time, we're super excited about the growth. This market is expected to grow like over 20% year by year in the coming years. And by 2029, it's supposed to be around $3 billion. And this market is not only diagnostics, it's also therapeutics, it's research. There's a lot of answers we still need to explore. But the good thing about this is that GA, genetic analysis, today have a solution to tap into this market and to fuel this growth. That's why we're so excited. And the next slide will show you where this growth will come from. This is a recent market insight report. And here you see that it's coming from everywhere, basically, from all the regions. And we know that North America with the US market is the most important right now. But looking in the future, we see both Europe and Asia and all the regions actually grow. And this is making us very hopeful and also excited, because we know that this is the future of modern medicine and a game changer, that you will map your microbiome when you get your diagnosis. So the growth driver, Ronnie, you were supposed to tell us more about the growth driver.
Yes, and you're quite right. Pharma is probably going to be the biggest driver going forward. But today the market is very much fueled by research. There is a lot of research going on in the microbiome market, a little bit diagnostics too, but mainly research. And there are some $5 billion being spent already in more than 700 programs to develop what we call microbiome altering drugs. These drugs are new and they will actively change your microbiome composition. And there are already a handful of players out there that has products in phase 2 and 3 in the US, and the market is just discussing who will be the first out, and there will be many products coming out. And where is the diagnostics? Because of course these patients needs to be selected, they need to be followed up and monitored during this process. And this is really why we believe that there is a huge market for GMAP. We are the only supplier out there with a standardized diagnostic platform for microbiome. And this is also highlighted now. In the US, there is a coalition called the Microbiome Therapeutics Innovation Group. The chairman of that group, here represented by Ken Blount, who is head of microbiome in Ferring, he underlines very clearly the need for standardization, also standardized diagnostics. And we were then very happy and proud to be the first diagnostic company that was invited into this coalition. And not only industry players and pharma, diagnostics and pharma players are looking at what we are doing. There is an increasing number of researchers out there who is kind of starting to see what GA is all about. So not only are we using our test in diagnostics, but in clinical research. And we have a vast network in especially Europe and the US that we collaborate with. And this has fueled an increasing number of publications that will also underline the usage of the GM app, where standardization is key because you can follow your patients over time. So where do we want to make the money? And well, first of all, we have our research in Oslo, where we do all the software development and all the chemistry, if I may say so. We have a manufacturing facility in Oslo where we produce the reagent kits, because the whole idea here is to, very diagnostics actually, we're going to place the platforms in the lab and we're going to sell reagent kit to the lab. So we do that out of Oslo, but we also have in-house service lab that will fuel the gastroenterologist down the street, the smaller labs that still doesn't have volume enough to set up the platform, and also, as I mentioned, researchers in academia and pharma that are using our service lab in Oslo. And this is very high gross margin business and very scalable. So we can take a lot more volume than what we are now seeing coming through. So Anita, can you maybe explain a little bit more what the typical customer could look like?
So as I said, we already commercialized. We have a proof of commercialization. We have customers in the US and in Europe. And a typical lab, molecular lab, will be a good customer who wants to set up this microbiome profiling platform. We would then, set it up with our sample collection kit if they need that. We would sell the reagent kit. We will also do a tech transfer with the Luminex platform readout machine. The software is a part of the product, and the beauty of this is that it's not sequencing. For those in the audience who know a little bit about this, is not sequencing, is a probe-based predetermined approach. So immediately the report will come out on your gut microbiome profile. And this is shown to be very valuable for the patient, first of all, but also for the healthcare specialist in this segment, I would say, of functional medicine. So when we are out there in the market, which we are already, we have this value proposition or positioning that we are the first to market with this technology, with the first routine diagnostic platform. We say and we really see that we're faster and better and cheaper than most of the research-based platforms. It's easy to integrate in a molecular lab who in the lab workflow. And we report, as I said, immediately. And this is also very important when you're working with diagnostics. So also when people think about this, is like, don't we have like billions and billions of bacteria and viruses in the microbiome? Yes, but what we've done is to pre-select the most important ones. And these are then determined by 48 probes that we designed. And this is the beauty of our test, that is validated and CE marked against a healthy population as well. So if you take the test in Shanghai or you take it in Oslo, the result will be the same. So I've learned it's quite standard diagnostics, but it's still very early days for microbiome. So, I mean, it's still a challenging phase, but we believe that this is the product that will drive this new way of looking at medicine. And the segments that we're looking into is medical diagnostics. We're also, like Ronnie said, very active with research. Daily, we get phone calls and emails about research group who wants to include our standardized test in their research. We also see that the future is all about companion diagnostics. So we would love to go into a partnership with a pharma, for instance, and see if we can develop some markers that they need to look at, like you said, the biologic therapeutics that are coming. More and more companies are looking at this from a consumer perspective. Today, if you Google microbiome and gut microbiome, a lot of companies are starting to look at the consumer segment as the most fast growing one. And I really believe that as well, moving post COVID and into this trend of health that is coming, that consumers will be as curious about their gut microbiome as their blood type or their gene disposition, where you're coming from, all this kind of testing. And we're getting very used to testing. This test market is also like, COVID has brought this testing, home testing mindset to our market, and this is also something we feel that we can leverage on. So that's our picture of the segments, but we are already growing slowly but surely. We are based in Oslo, and we have distributors in the US. We have a solid partner and also Biorad as the owner in our back, who has our back, I would say. But we have a very good professional partnership also with Luminex, which is one of the global players when it comes to readout machines. And we recently also signed up with a partner in China. So this is exciting to see the world, the GA world is growing. It's like a GA map. And we see that more and more attraction is coming day by day in other regions and from other geographies. Yep.
You're quite right, Anita. There's a lot of things happening. And if you look at our news flow, you will see that we are very busy. And since we listed in 1st of October 2021, there is I picked 5 milestones here, could be more. We have adapted our GA map onto a new instrument platform from Luminex, makes the lab to run this cheaper in a way. So it's a cheaper entrance for the lab. And this is again gives us a bigger commercial bandwidth that we have the test on more instrument readout platforms. We have further strengthened our patent portfolio in China, in Europe, and in the US. We are happy to see that one new high volume customer launched their products in Germany. They are going pan-European, but they started in Germany. So that happened now in February. And we launched a new version of our product in the US that again has shorter runtime in the lab, so it gives the lab a more profitable run, I would say. And as you mentioned, we signed in January an agreement with Talis Medical, a Chinese listed company in Shanghai, to first of all distribute our test in China, but also to co-develop new microbiome diagnostics for China. So that's very exciting. So, well, if you look at GA, why should you invest? Well, as I've said, we are a very, very exciting company in a sweet spot, namely the microbiome. We are a unique positioned within diagnostics, but we also have a highly skilled management and board that has been through this before with pharma and diagnostics experience. And we will now focus on ramping up the commercialization of our current product that we have in the market in US, Europe, and Asia. And we have a very exciting pipeline of new markers coming to the market that will fuel future revenues too. So that's our story.
That's our story. Hope Hippocrates is happy now because finally we're listening to him. So hopefully your gut feeling is the one that we should go for. So thank you.
Thank you.
Då gör vi så här så att vi kommer nära varandra. Jag tar det här bordet och så får ni det
Ja,
bordet.
vi kan stå her, vi.
Perfekt.
Og nå avslører vi at vi var de norske i salen.
Det var ni som ställde frågan. Ja.
Ja.
Ja, men då har landsmännen klivit fram.
Ja.
Bra. Och det är fortfarande så att frågorna om ni vill ställa, det ställer ni via samma ställe som innan. Fota baksidan. Börja med, nu har jag fått frågorna på engelska, men jag ska försöka översätta dem. För vi försöker köra på svensk-norska. Är det något specifikt partnerskap eller samarbete som ni inte har idag, men som ni skulle vilja ha?
Vi kan jo si det der med at vi hele tiden er på jakt etter nye partnere innenfor både diagnostikk, men også innenfor farma. Vi er åpne, som mange har sagt før. Vi er fortsatt tidlig scale-up, så det å liksom finne rette strategisk fit, det er viktig for oss. Vi ser på alt fra probiotika til farma til biotek.
Spesielt innenfor pharma, og kanskje litt mer at the more big players start moving into it. Så vi er veldig på jakt etter et større cooperation, som du sier.
Förra året så blev ni listade som det första bolaget på norska Spotlight Stock Market. Hur kändes det? Hur var den erfarenheten?
Nei, det er det bildet der, da.
Så kändes det.
Ja, det var nyttårsaften og 17. mai og julaften samtidig.
Det var veldig, veldig trevlig. Det var så godt å se faktisk interessen fra investorene. Den var veldig stor. Vi gjorde en veldig god listing, vil jeg si. Selvfølgelig børsen har jo gått så der efterpå, men det kan vi ta efterpå. Men jeg synes også det var veldig viktig å se hur mycket attention vi får også business-wise. For når vi blir et listet bolag så må vi gjøre mye mer på newsflow, vi må posisjonere oss. Så vi blir lagt merke til også, så det er med på å fuele vår business på en annen måte. Så vi er mye nøyd med listingen.
Det har också kommit en fråga från publiken. Ni berättar att ni är nöjda med vad ni har gjort sedan ni kom in på börsen. Hur ser vägen framåt ut, kanske framförallt då i år?
Ja, jeg kan kanskje starte med det, men selvfølgelig det som er viktig for oss nå, det er jo å øke den kommersielle veksten på de produktene vi har. Vi er den enda spelaren der ute på diagnostikk, som jeg vil kalle reell diagnostikk, standardisert diagnostikk. Og markedet er fremdeles litt tidlig, men det er virkelig på rett vei. Så det viktige for oss, det blir jo å finne de riktige partners og gjøre flere avtal.
Absolutt. Kommersialisering og akselerering av vekst. Men jeg vil også si the first mover advantage her, som du sier, er veldig, veldig viktig for oss. Og jeg merker jo mer og mer at de firmaene som jobber med dette er lengre bak oss. Så det at vi nå er så i forefront, det må vi utnytte. Og så er det jo da å jobbe veldig strategisk mot de store volumene og de store markedene. Vi jobber ikke i hjemmemarkedet nesten, det kan jeg bare si. Det er USA, det er Europa, og så er det nå Asia. Så det er veldig spennende.
Ytterligare en publikfråga. Vad är de största utmaningarna som finns framför er på 2-4 års sikt?
Hva skal jeg si? Først og fremst er det jo også lite tungt av og til å ikke ha konkurrenter. Det høres kanskje litt belærende ut, men konkurrenter er også viktig, for det er med på å bygge marknaden. Så det er en ting som vi nå, som det første diagnostikkbolaget, så blir vi lagt merke til. Men av og til så kunne det vært godt å ha konkurrenter også, som kunne vært med å bygge marknaden.
Ni får vara ensamma och break the ice liksom.
Ja. Så det er en utmaning.
Ja, det er en veldig stor utfordring som vi ser spesielt når vi skal snakke globalt, ikke sant? Og så har du forskningsbaserte metoder som konkurrerer med oss, men det er ikke det samme, for vi er de eneste som er klinisk validerte og standardiserte. Så det å fortelle den historien, det å liksom lille GA komme ut og si det, det tror jeg er det noe av det tyngste vi gjør, men vi får gehør, men vi trenger noen som kan fortelle historien sammen med oss, tror jeg, Ronny.
Og jeg husker i GEA, vi var den første som etablerte det var en normal gut, normal mavetarm er for Europa. Og en del opinion leaders, du vet, de lo av oss og sa, hur kan ni komme og si dette? Og det har vi gjort, vi har stukket hodet fram. Vi har også gjort det nå på USA, og vi ser at dette begynner å bli globalt lagt merke til, fordi det er veldig viktig at noen setter baseline. Hva er en frisk gut, og hva er ikke det?
Så det å liksom bygge markedet det er ikke lett å gjøre helt alene, men vi er på vei.
Hur dyrt uppskattar ni att det kommer vara att gå från semimanuell produktion till fullt automatiserad produktion?
Hos oss i vår reagent production. Det var en vanskelig fråga egentlig. Jeg vil ikke si at det er dyrt. Jeg vil heller si at så fort vi får opp volumene og kan gjøre ting mindre manuelt, så vil faktisk vi øke vår gross margin. Så i den respekt så...
Du ser det mer som en investering än att det är dyrt?
Ja, absolut.
Men tror du att det är något som kommer behövas mer pengar för att kunna göra? Eller?
Selvfølgelig, du kan godt være at vi investerer 2 millioner kroner i en helautomatiseringsfyllelinje for eksempel. Ikke i år, men for å ta mer automatisert produksjon efterhånden.
En fråga jag brukar ställa också som kanske min favorit, men om ni ska sammanfatta, vad vill ni att de här hemma eller de som sitter här går hem och funderar på att ta med sig för budskap från er?
Har du noen tanke?
Jeg har bare, what is your gut telling
Nu jag vill ha one-liners.
Ja. Nei, microbiome is a game changer in the future of medicine. Det er bare det jeg vil si. De som tror på det, de tror virkelig på det, og det kommer til å komme mer og mer. Og vi er de første som har en test på markedet i dag, så du kan egentlig ta GMAP i dag.
Jeg vil også si at det er jo helt vanlig nå at du tar en blodprøve når du kommer til legen for å se hvordan er helsetilstanden din. Jeg tror ikke om veldig få år så vil du naturlig nok ta en avføringsprøve for å se hvordan your gut is, the health of the gut. Og vi ser også nå på det å ta spyttprøve i stedet for fesesprøve, hvor mye similært kan du si på det du har av spytt kontra dette. Så dette er et veldig spennende område som kommer til å bare vokse.
Ronny Hermansen och Anita Patel Ljusnäs, tack för att ni kom.
Tack.